Hi, my name is Darren Maines. This is debate one for HCA 71. I will be discussing if COVID-19 lockdowns did more harm than good. I am in the opposition group, so I'll basically be discussing that COVID-19 lockdowns did more good than harm. So kind of a little brief introduction. We all know what COVID-19 is. It's a viral respiratory disease that spreads through droplets in the air. It first appeared late 2019 and was declared as a pandemic um, in about March of 2020. Um, One strategy that was used to help target the spread of COVID-19 was lockdowns, which is a type of non-pharmaceutical intervention, or NPI, which is a type of strategy that reduces morbidity and mortality of infectious disease by restricting mobility of people, so that's preventing people from going into public places and just preventing person-to-person contact. They're implemented differently in different countries with various levels of restrictions. We saw shelter-in-place orders, stay-at-home orders, um, school closures, non-essential business closures, um, and so alongside vaccine and mask mandates, which are not a type of MPIs, but were used alongside with the lockdown to help reduce mortality and mobility in the spread of COVID-19. So there were several positive effects that came from the lockdown, and one of the most obvious ones was the reduction in mortality and morbidity, which is what it was intended to do. Um, so one study kind of examined the effects of lockdown. So the lives saved during lockdown, during the potential lives lost due to the economic effects caused by that lockdown. So many people argued that lockdowns kind of reduced economic stimulation, increased job loss, um, and they say lockdowns alone helped increase mortality. This study kind of argued against that. So there were 1.7 million lives saved from the COVID-19 lockdowns versus about potentially 250,000 lives lost due to mortality related to the economic effects of the COVID-19 lockdown. So a significant difference there. And I do think the effects of the COVID-19 lockdown in the lives they saved is much greater than the potential economic effects caused by that lockdown. So shelter-in-place orders saw a 35% decrease in mortality across various countries. In the United States, at the end of 2020 and the beginning of 2021, COVID-19 was the leading cause of death in the United States. In the U.S., although we did have some restrictions, they were pretty minor and less restrictive compared to other countries. Um, the lockdowns helped reduce transmission rates of the spread of COVID-19. So there's a decrease in about 56% of infections, which is also equates to 480 per 1 million people consumers. Um, Countries who did not implement interventions or had fewer restrictions had the higher morbidity and mortality. I do want to address the concept of excess mortality. So that's the total deaths from all causes, including COVID-19, um, or above expected or above normal conditions during a crisis. Um, so some some countries with few restrictions had higher excess mortality. So with no lockdowns, they had higher excess. So higher deaths from all causes during a crisis during COVID-19 pandemic. So Brazil is one example. Uh, so to kind of go in depth on a country, Sweden, they had fewer cases in the beginning of the COVID-19 pandemic. But they implemented more restrictions early on, and research shows that countries who did that, who implemented higher levels of restrictions early on, despite not having a significant amount of cases, they had that reduced mobility and mortality from COVID. And so in this study, there were absence of restrictions. The absence of those restrictions would have increased mortality rates. And one reason that is due to less hospital beds. COVID-19, encouraged the lockdowns to encourage people to stay at home, not utilize emergency care services or healthcare services. There's also a fear of utilizing those services due to being exposed to COVID-19. Um, so those restrictions weren't in place. People would have went to the emergency room as normal, would have been using uh, hospital inpatient services as normal. So there would have been less hospital beds available, which would have put COVID-19 patients at severe risk for mortality. And in case they needed a ventilator or ICU treatment. To look more at the effects of the COVID-19 lockdown in Sweden, there were more than 11,000 potential lives saved just between March and September 2020 alone. And to put that into perspective, there were more than 24,000 confirmed COVID-19 deaths since January 2020 up until now. So that number between those small months is nearly half of confirmed deaths in Sweden throughout COVID. So we're going to go into some unintended effects that weren't planned. They weren't included in the purpose of the lockdown, but happened anyways and had pretty significant positive effects, especially towards public health. So reduced environmental pollution. Lockdowns reduced the amount of motor vehicles on the road. People stayed at home for work. People went to school from home. People didn't need to drive as frequently. So that showed a decrease in greenhouse gas emissions, which showed it had positive impact and decreased the development of global warming and climate change. But there's also a 30% reduction in environmental pollutants, and whether that's from car emissions or other sources. That led to kind of a decreased spread of respiratory ailments from pollutants, COPD, hypertension, stroke, and other related conditions. And similarly, there were reduced motor vehicle accidents. Less cars on the road meant less opportunities for people to get into car accidents. A study in Greece showed reductions in collisions, major injuries, minor injuries, and fatalities. And there were pretty significant reductions at that. And these effects were seen in multiple countries, including Canada and the UK. To continue on, there's also reduced incidence of other diseases. COVID-19 is an infectious disease that spreads in the air through person-to-person contact. There are several other diseases that spread similarly to that. So lockdowns had the similar effect as COVID to those diseases. Um, so the reductions in acquired respiratory and febrile illnesses, um, specifically influenza. So the World Mortality Data Set, which kind of keeps track of global mortality, reported fewer total deaths by themselves during COVID-19, and there's a 3 to 6% decrease in mortality solely based on the reduction of influenza. Um, and that's due to that reduced personal contact and fear of exposure. Now, I do kind of want to address the opposing side and just the potential harms correlated with the COVID-19 lockdown. So, there were reduced medical screenings and healthcare utilization during COVID-19. Um, and many people attribute that to the lockdown. So, reduced medical screenings can put people at risk for, having these medical conditions going undiagnosed and untreated. Um, but research shows that that's not necessarily due to the lockdown itself, but the effects of the pandemic. So the pandemic forced healthcare, hospitals and other sources of delivery to reallocate their staff to the pandemic response, whether that's through testing, treatment, especially in the hospitals. There were, COVID-19 units solely just to be treating COVID-19. Also limited patient capacity, whether that's people who quit healthcare due to the stress of COVID-19 or lives lost from COVID-19. There has also been a negative impact on mental health associated with COVID-19 lockdowns. So some people say that's due to the increased periods of self-isolation during COVID and those lockdowns. But there's limited evidence on that. So research really can't distinguish between if the lockdown or the pandemic itself is the cause of those reduced mental health outcomes. Who to say if it was the lockdown that caused someone to mental health to deteriorate, or the loss of a loved one, or their COVID-19 status impacted their mental health as well. People are concerned about the damage and long-term impact of the lockdowns, whether that's on an economic aspect or a social aspect. But it's important to mention the long-term effects of COVID-19 seem to be more concerning due to their unknown nature. No one knows how severe they are. No one knows really what the extent of those impacts are going to be, especially on the older population, the younger population, or the vulnerable at-risk groups for COVID. And kind of just one overlying effect is the limited evidence that correlates the harms of COVID-19, um, the harms of COVID-19 lockdowns, uh, to there's limited evidence that that correlates the negative impacts of the COVID-19 lockdown to those negative harms. And that is the rest of my presentation. So in conclusion, lockdowns have multiple positive effects that improve public health, including reduced mortality, morbidity, reduced pollution, reduced incidence of other diseases, and motor vehicle accidents. Here are my references. Thank you so much.